Okay, so my presentation is the Assessment Evaluation Report of Beck Depression Inventory. Particularly the second edition is the one that we will mainly focus on, but I also touch on the BDI-A, which is the original Beck Depression Inventory. And I also touch on a few of the revisions. And it's by me, Medine Presley, at Loyola Marymount University for the Assessment, Appraisal, and Diagnosis and Counseling course, instructed by Stephanie L. Bailey. All right, Dr. Stephanie L. Bailey. All right. So some general information. It's the Beck Depression Inventory, second edition, and it's authored by Aaron T. Beck, Robert A. Steer, Gregory K. Brown, and the reviewers that I took a look at some of their reviews of the instrument is our Bessie P. and R. Farmer. It was published in 1961 originally and revised in 1996. The publisher is Pearson Assessments. The manual source is the 14th Mental Health Measurements Yearbook from 2001. And the material that you're going to need for this particular instrument would be paper, pencil, questionnaire manual. You'll need a complete hand score kit and recording forms. Those are kind of like extra materials that you would need to make the or to perform the instrument. Generally, it takes about 5 to 10 minutes to administer, and it can be given to both adults and individuals. And the database in which I got my research was the Mental Measurements Yearbook and Tests in Print. BDI was originally designed to be an inventory that approximated clinical judgments of the intensity of depression, usable mainly for research purposes. In 1961, it was revised. It was actually originated in 1961, rather, and it was revised in 1996 to be more consistent with the criteria for depression as outlined in the DSM-4. The BDI-2, or rather in the BDI-2, individuals are asked to respond to each question based on a 2-week time period, rather than the 1-week time frame which is utilized in the original BDI. There's also a short version of the BDI, and it's called the BDI-SF, short form. That's what SF stands for, short form, which includes only the cognitive affective subscale and has been recommended to assess depression in medical populations. There's also the Beck Depression Inventory for Youth, ages 7 through 14, that has demonstrated good convergent validity with the Children's Depression Inventory. Beck's Depression Inventory has also been used in numerous studies with trauma-exposed individuals, combat veterans, women who have experienced intimate partner violence and sexual abuse, as well as PTSD. When used in adolescents, the population age range is usually 12 to 17. According to the National Child Traumatic Stress Network, BDI-2 is designed to assess state-related depression and could be used as a quick weekly screener prior to therapy sessions. Finally, the BDI has been used in evaluating bereaved elders to determine if the depressive symptoms are a part of the normal process of grief, or if they are indicative of a clinical level of depression. The BDI has been extensively used as well with younger and middle-aged depressives as a measure of change in intervention studies using either psychotherapy or pharmacotherapy or both. Really quickly, I wanted to go over some of the evolutionary history of the BDI, just a few quick points, and then I wanted to point you to the video that's about 4 minutes long, but it's from Dr. Beck himself, and so that's a good historical marker, a good video to watch. Beck Depression Inventory, again, was developed in 1961. There was some initial criticism of the scale, and so it had to be revised in 78. And the publication of the DSM-5, that particular manual that diagnoses mental health disorders, it caused another revision in 1996. And we have the most up-to-date version now, the BDI-2, which is also based on the DSM-5. And I now direct you to the video with Dr. Beck. The Beck Depression Inventory has had over 60 years of universal use. However, both the reviewers that I looked at, which was Wu and RBC, placed the age range for the use between 13 and 80. Therefore, junior high school kids and retirement communities, anywhere in between there, could both utilize the BDI to assess severity of depression within their respective populations. The BDI-2 was administered with over 500 outpatients in 1996 in various clinical settings in New Jersey as a standard intake for psychological battery. They also used the instrument with 120 college students on different campuses, targeting those specifically enrolled in an introductory psychological course. BDI has also been used in clinics that serve combat veterans diagnosed with PTSD. In 2003, it examined the psychometrics, or the psychometrics were examined rather, of the Spanish adaptation of the BDI-2 with more than 470 non-clinical adults, and the psychometric properties of the Arabic version was studied in 2001 of the BDI-2 and has been examined with students aged 18 to 37 at the University of Bahrain. The authors suggest that the findings support the BDI-2 in these populations. So that's just kind of some of the types of agencies and schools in which the BDI has been used. The original BDI is a 21 question or 21 item self-scored self-report questionnaire. The BDI-2 retains the 21 item format with 4 options under each item, ranging from not present, which would be 0, to severe, which would be 3. Items dropped from the BDI, include body image change, work difficulty, weight loss, and somatic preoccupation. Replacing these 4 lost items, the BDI-2 included the following new items: agitation, worthlessness, loss of energy, and concentration difficulty. The BDI-2 can usually be completed within 5 to 10 minutes. In addition to providing guidelines for the oral administration of the tests, the manual cautions the user against using BDI as a diagnostic instrument and appropriately recommends that interpretations of test scores should only be undertaken by qualified professionals. Although the manual does not report the reading level associated with the test items, previous research on the BDIA suggested that the items were written at about a 6th grade reading level. Coefficient alpha estimates reliability for the BDI with outpatients was 0.92 and was 0.93 for non-clinical sample. The retest reliability coefficient across a period of a week was quite high at 0.93. Retest reliability was assessed over a week interval versus a 2-week prescription, which is post DSM-4. Among a small subsample of about 26 outpatients, this was in 1983, from only one clinical site, and the rating was 0.93. No significant change was found in scores among the outpatient sample between the two testing occasions. That was reported by RBC and Farmer in 2021. In the 1980s, multiple tests were used to judge reliability. They used split half and item total correlations, with both seems to have been adequate. The validity, the validity of the BDI-2 was evaluated with outpatient subsamples of various sizes. The correlation between the BDI-2 and BDI-A were found to be quite high, even when administered on the same occasion. The rating was 9.3. Population sample was 101, suggesting that these measures yield similar patterns of scores, even though the BDI-2 on average produced equated scores that were about 3 points higher. The test manual also indicated that of the 500 outpatients, those diagnosed with mood disorders, about 264 persons, had higher BDI-2 scores than those diagnosed with anxiety, 88. The test authors also cite evidence of validity by separate factor analysis performed on the BDI-2 items set for outpatients and students. However, these reports, which were different in some significant respects, are questionable evidence of the measurement's validity, as the test was apparently not developed to measure particular dimensions of depression. Administration and scoring. It can be given to a group or an individual. It's total scores only. It's hand-scored or computer-based administration. Scoring and interpretations also are available. The number of items is 21. The average time to score is about 2 minutes. Average time to administer is about 5 to 10. And you would need to have the manual and video for training to administer and then to interpret as well. And you'll basically just need paper and pencil to do the basic instrument. There's other forms that you can get as far as scoring is concerned and reporting. Format of administration, like previous versions, the BDI-2 contains 21 items, each of which assesses a different symptom or attitude by asking the examinee to consider a group of graded statements that are weighted from 0 to 3 based on intuitively derived levels of severity. If the examinee feels that more than one statement within a group applies, he or she is instructed to circle the highest weighting among the applicable statements. A total score is then derived by summing the weights corresponding to the statements endorsed over the 21 items. Some of the advantages of the BDI in my summary and conclusion: the BDI-2 is widely used and accepted as a measure of depressive symptomology. BDI-2 can be administered orally by an examiner with those with reading difficulties or problems with concentration. It's pretty friendly, user-friendly. It's translated in multiple languages other than English. BDI-2 is also designed to assess state-related depression and could be used as a quick weekly screener prior to therapy sessions, which is quite convenient for psychotherapists. And the measure has been found to be useful in detecting change in treatment outcome studies. Probably the most glaring disadvantage of the BDI-2, beyond the fact that there's not a lot of research in older adults, its use in older adults and mainly people over 60 years of age. And there is some underreporting, over-reporting due to the face validity of the BDI-2. But I think that the most glaring highlight is the normative sample is predominantly white. 91%. That's overwhelming, and so there needs to be a lot more multicultural diversity in testing and application there, and I'm interested in studying and seeing how that work looks in 2021 and going forward, because it seems like a very useful tool, but it needs to be applied in multicultural settings. I think that there's been some cultural universalizing of the tool, and there needs to be some more culturally relative tests. And so that's pretty much my presentation for the BDI, the Beck Depression Inventory. My references are on the next slide, and thanks for your time.